Well, good afternoon. Welcome to the City of Toronto COVID-19 media briefing for Monday, May the 11th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor?
Well, Brad, thank you and good afternoon. I want to start today by recognizing the fact that it is National Nursing Week across Canada, where we honour the vital role that nurses play in all of our communities. Toronto is also proclaiming this Nurses Week in Toronto. We've done this proclamation in the past, but this year, of course, it has extra meaning for all of us. During the COVID-19 pandemic, nurses are one of the larger groups of essential workers who are constantly on the front lines of this crisis, not only in hospitals, but also in our long-term care residences and in other places. Today, more than ever, we need to recognize the tremendous professional dedication and personal sacrifices that are made by nurses to help all of us. They are the first point of care in our communities, and they work tirelessly to provide the compassion and the attention people need whenever and wherever they need it. Please do your part by helping nurses during this week and beyond by practicing proper physical distancing and frequently washing your hands. The more we do to protect ourselves from COVID-19, the more we help nurses, other healthcare practitioners, and frontline workers to get through this crisis. I would like to extend my appreciation and gratitude, and I'm sure I speak on behalf of all of the people of the City of Toronto in extending that gratitude to the more than 37,000 nurses currently working throughout Toronto, and to the 1,650 plus nurses who work for the City of Toronto and for Toronto Public Health. And those working for the City, of those working for the City, the more than 1,100 nurses working in the City's 10 long-term care residences. The work that you are doing is central to us surviving this pandemic and to emerging from it in the best way possible. And we, in turn, will continue to support you in every way possible in the work that you do, as we have tried to do before and during this pandemic, and as we will do after. I'd like to return for a moment in today's briefing to something I discussed last Friday in response to a question, namely the critical and urgent importance of getting the attention of the provincial and federal governments with regard to the dire financial problems being faced by Canada's cities, including Toronto. This is not just a matter of dollars and cents, though. As I have reported to you previously, the numbers are big, with Toronto's pandemic-related shortfall alone exceeding $1 billion, led by $20 million a week, in excess of $20 million a week, for example, in lost transit revenue alone. The reason it goes beyond dollars and cents is because the variability of the province and the country to enjoy as quick and as complete a recovery as possible will largely depend on the ability of cities to generate that recovery, because they are economic engines, and Toronto, of course, is the economic engine of the country. The country is counting on cities led by Toronto to make sure that recovery happens. Again, as I've previously pointed out, 20% of the country's entire GDP comes from the Toronto region. And if the municipalities in that region, and for that matter in other parts of the country, are financially crippled, we will not be able to play the role that our leadership, where our leadership is required in the recovery across the country, the kind of robust recovery we all want to see and that we need to see. I spent a good deal of time on the weekend speaking with federal and provincial ministers, trying to get this placed as a priority item for discussion. I will, as well, in the coming days, again be meeting with my fellow GTHA mayors and with the federal MPs from Toronto to highlight the urgency of this issue. I am optimistic that if the province follows some of its good work during this pandemic on areas of provincial responsibility like homelessness and landlord and tenant matters, we can get the whole country, including the federal government, to keep our cities in fighting form financially so that they can lead the recovery as they must in a country where 80% of Canadians live in cities. I'll be trying to consistently raise the profile and the urgency of this issue in the coming days as the time to come together and to ensure the continued financial viability of our cities across Canada is now. We're also committed to doing everything we can to help our Main Street businesses get through this crisis. And that is why we are working with the business improvement areas across the city to help shops as they reopen today for curbside pickup. Instead of having squads of well-meaning city staff trying to implement these first reopening steps with clipboards and rolls of yellow tape, we have turned to businesses themselves, through the BIA and directly, to make sure that these initial steps are taken in a sensible, safe manner. Today, I'm pleased to announce the launch of Shop Here, a program to help Toronto independent businesses and artists to have free online stores in order to minimize the economic impact of the COVID-19 pandemic. The Shop Here program is part of our short-term economic support and recovery plan for Toronto and will provide Toronto's independent businesses and artists the opportunity to develop an online store, which will be built and launched for free in a matter of a very few days. We know that the economic impact of this pandemic is taking a significant toll on Toronto residents, artists, and businesses, particularly the small, independent, Main Street businesses and individual artists. The launch of the Shop Here program is just one more example of what the City of Toronto is doing with the business community, the education community, and the nonprofit sector to help those who need help. Small businesses are the backbone of our neighborhoods, not just of our economy, but of our neighborhoods, of our healthy neighborhoods, and that is why it is so important for us to help them. Shop Here will not only help these valuable members of our neighborhoods survive, it will allow all of us to get more services that we need online so that we can take advantage of the new curbside pickup options or of home deliveries. It is interesting, but not necessarily surprising to note that businesses with an established online shopping presence have been able to maintain significant sales during the period of the shutdown so far. Through the Shop Here initiative, hands-on support will be provided throughout the entire process, from volunteer website developers and marketing and business students. The program will provide Toronto's independent businesses and artists with a template to develop an online store, customized with the information, branding, and logo of the business or the artist, hands-on assistance setting up and launching the online store, training and support for digital marketing, shipping, and operating an online store, and access to free tools and online advertising credits to support the launch of the online store. An estimated 49,500 Toronto businesses, 7,300 of them restaurants, bars, or cafes, are eligible for the Shop Here program. The initial program is available now through to the end of August, and our goal is to develop 3,000 online stores, new online stores for Toronto's independent businesses and artists. I want to thank the numerous community and corporate partners who are supporting Shop Here, starting with Davila, the Toronto Association of Business Improvement Areas, also Shopify, Google, MasterCard, Microsoft, Facebook, eBay, Ritual, TrueFan, eShipper, Snapchat, Magnet, and the Schulich School of Business, as well as Toronto's tech community, which has once again stepped up to the challenge and is actively engaged helping our local economy to recover. A number of other companies have already agreed to participate and support this effort, including Global Skills Hub, Scotiabank, General Assembly, BrainStation, Juno, FreshBooks, Next Canada, TechTO, and Tribal Scale. And I want to thank those who have stepped forward already, all of those that I've mentioned and more. This is good corporate citizenship. This is the Toronto way of doing things. We work together to support each other. Today, I'm issuing a challenge for even more Toronto technology companies to get involved, as they've done countless times during this pandemic, and volunteer to build online stores for Toronto's independent businesses and artists. The Shop Here program will be delivered via the Digital Main Street platform, a City of Toronto initiative, so we will work on the foundation put in place by Digital Main Street, which itself has had its budget tripled this year by the city in response to the pandemic. Toronto independent businesses and artists can sign up for their free online store at digitalmainstreet.ca/shophere. We're going to get through this pandemic, and we continue to work each and every day, not just doing the plans and putting the plans together for brighter days that lie ahead as the numbers improve, but also to make sure we support people during the currency of the pandemic. We are doing everything we can to make sure we provide those who need help the most with the help that they need. And it's now my pleasure to call on Dr. Eileen Davila, our Medical Officer of Health, for her report for today.
Thank you, Mayor Tory, and good afternoon. While our data are telling us that we are making progress in our battle against COVID-19, we continue to see new infections in our city. For today's update, there are a total of 7,557 COVID-19 infections in Toronto, an increase of 144 since yesterday. To date, 5,340 people have recovered, an increase of 148 since yesterday. I encourage you to visit our website for more details on the status of COVID-19 cases in our city. Also, by way of update, I wanted to share that I recently learned of the first COVID-19 death in a resident in our shelter system. Sadly, on May 8th, a man in his 50s who was a resident at Dixon Hall Schoolhouse died in hospital. On behalf of my team, I extend sincerest condolences to this individual's friends and family, and to all others in our community who have lost loved ones to COVID-19. While there was an outbreak at the shelter in April, it was declared over on May 5th. All clients were tested, and to prevent further COVID-19 spread in this facility, my team provided guidance to ensure enhanced infection prevention and control and physical distancing measures were in place. Enhanced cleaning and disinfection measures were in place. Signage on hand washing and COVID-19 signs and symptoms are on prominent display. And as well, that there is active screening for symptoms that's being conducted at the shelter. In addition, my team investigated all confirmed cases of COVID-19 at the facility and provided recommendations on self-isolation spaces and consultation on how to triage clients appropriately into self-isolation facilities. On a more positive note, as you heard from Mayor Tory, today is the beginning of National Nursing Week. Like Mayor Tory, I want to recognize the commitment and leadership of nurses who care for our city. Every day, there are thousands of nurses in our city working to protect and promote health in many settings, including public health, hospitals, primary care, long-term care homes, shelters, and in various community settings. Now, many of the nurses at Toronto Public Health are working behind the scenes and on the front lines in our battle against COVID-19. Anyone who has spent a few minutes in a hospital or in any healthcare setting knows firsthand that nurses play a critical role in our health system. They blend their technical expertise with compassion, care, and empathy. While nurses are perhaps best known for their role in patient care or in community care, they also play important roles as teachers, mentors, and as advocates. The theme of this year's National Nursing Week is Nurses, a Voice to Lead, Nursing the World to Health. Nurses certainly bring this theme to life each and every day, especially in the context of the COVID-19 pandemic. Thank you to all nurses for your daily work and action to help reduce the spread of COVID-19 in our city. I've been asked to provide an update on our case and contact tracing work and how close we are at Toronto Public Health to meeting the province's target to reach 90% of COVID-19 cases and contacts within 1 day of diagnosis. I'm pleased to report that our team is well on their way to achieving this target. We continue to scale up and train staff to work on this important function of our COVID-19 response. Currently, there are over 500 Toronto public health staff working on case investigations and contact tracing, and we are redeploying and training additional staff every day. We also have 45 volunteers supporting these very detailed investigations. This is always being assessed and reassessed to ensure that we have enough staff resources to meet the evolving needs of this important work. In the early phase of our outbreak, the number of new cases in Toronto was doubling approximately every 4 days. Now, the number of cases in Toronto is doubling every 7 days. We should all derive comfort in this because it is another sign that our work together, is slowing down this epidemic. Prior to implementing strict public health measures in mid-March, each infected person in Toronto infected an average of 3 other people in our community. By the end of April, for the first time since our local outbreak started, this number dropped significantly, with each person infecting an average of 1 other person. COVID-19 activity is declining in Ontario and in Toronto. However, we do continue to see new cases in our city. In fact, yesterday, approximately 50% of all newly confirmed cases since the previous day reported by the province were here in Toronto. We need to keep up our commitment to physical distancing to continue to slow the spread of the virus so that we can safely reopen our city and get back to enjoying time with our loved ones. I think everyone will agree with me that not being able to hug our mothers yesterday reinforced just how critical it is for us to get this right. So please, continue to practice physical distancing when you go outside, and please continue to take care of each other. I'll now hand it over to Chief Pegg for his remarks.
Well, thank you, Dr. Davila. Excuse me. And before I begin, I just would like to take a minute to acknowledge that this is Police Week in Ontario. And since 1970, I believe, we have taken pause this week to both, I think, give thanks and to recognize and acknowledge the hard and dedicated work that the members of our police service do each and every day for us. So on behalf of all of us, and I'm sure on behalf of all of our city, I would like to extend my sincere thanks to Chief Mark Saunders and to each of the women and men of the Toronto Police Service for all they do for us. I can tell you from firsthand experience, it's tireless work, and day in and day out and night in and night out, our police officers are on the very front line doing much for us in public safety. So to each of them, my sincere thanks and acknowledgement. Today, as you know, Curbside Pickup for retailers was launched across the city. The EOC, working with Toronto Public Health and the local BIAs, developed guidelines to ensure public and employee safety. These are available on toronto.ca/COVID-19 for anyone who would like to access them. This is new for everyone, and I want to thank the public and businesses for their cooperation and understanding as we work through all of this. We are monitoring and adapting where necessary. As more parts of the city slowly begin to reopen, whatever the model, the EOC will help ensure that we're in a strong position to implement a plan that fits Toronto's needs. We can learn from other jurisdictions, but each is, of course, unique, so Toronto will build on the learning of others. We will continue to create our own plans, each under the guideline of Toronto Public Health. As I have said many times here, the Toronto Public Service has been here from Torontonians from the very beginning of this pandemic. We know that the TTC, solid waste, Toronto Water, shelters, long-term care homes, and our first responders have continued to meet the needs of the city. But there are others within the city family that work behind the scenes to ensure we function efficiently and effectively. This includes finance, technology services, facilities, our administrative support staff, and Toronto Community Housing staff, Canada's largest landlord, who are doing everything they can to ensure their residents are well looked after. The response to COVID-19 in Toronto continues to be both a sprint and a marathon. We will continue to ensure things like PPE are actively monitored and that we always have an eye towards the immediate short-term needs, while also ensuring we're planning for the long term. As we adapt and evolve our response to the pandemic, please check back frequently at toronto.ca/COVID-19 for the latest developments from the City of Toronto. Thank you.
Thank you, Chief. Before we go to questions, just to let everybody know on the line that Mary Ann Bedard from Shelter Support and Housing, as well as Paul Raftis from Senior Services and Long-Term Care, are available should you have questions. And the first question goes to Tracy Tong from CTV News. Tracy?
Hi there. This question is for Mayor Tory about the scope of the Shop Here program. You mentioned a goal of getting 3,000 online stores set up. How long do you think that will take with this team? And about 2 months in, with the reopening of storefronts happening now, 2 months in, and I'm referring to the closure of non-essential businesses, do you think it's a bit late for this effort to begin now?
Well, actually, it's building on an initiative we already took where we tripled the budget of the Digital Main Street program earlier on. So there have been the possibilities, and indeed they're delivering on hundreds of new businesses in addition to the 3,000 that will be covered by this new initiative, building again on the Digital Main Street program. So I think this will help a lot of businesses, and of course the benefit isn't just during the pandemic period, the benefit is long thereafter, as it helps these businesses, many of which have been around for a long time, to adapt to some of the new realities of retail in the City of Toronto. So I think we took a step early on to triple the budget of Digital Main Street. Now, with the help of all these companies and the Schulich School of Business, we're adding in this program, which will help 3,000 businesses in the next few months, and I think that's going to be a very significant contribution to these smaller businesses and artists in the City of Toronto.
Okay, thank you. And I have a question for Dr. Davila as well. Some encouraging news that you're sharing today in terms of infected people now infecting less people on average. Are there any patterns you can speak to in terms of who these infected people are infecting? Are they mostly within the same household or when they're out? Can you speak to that aspect of it?
Yes, of course. So what we have noted over the course of our investigations is that those who are at highest risk are household members of positive cases of COVID-19. Not particularly surprising, and certainly gives more credence to the fact that you need that close, sustained contact with somebody in order to get a transmission of disease from one person to the next. So clearly, strongest link is within household, close, sustained contact with somebody who actually has been shown to have COVID-19 infection.
Okay, thank you. We go now to Siobhan Morris from News Talk 1010. Go ahead, Siobhan.
Hi, my questions are for the mayor. Mayor Tory, the requests you're making for financial help from the province and the federal government, we heard more today about how bad things might be on the provincial front over the next number of months in terms of deficit. So what's the plan B if the government comes back to you and says, listen, we don't have anything to give?
Well, I would say there is no plan B because any of the plan Bs you might contemplate are not acceptable. The notion of, for example, bringing in a 30 or 40% property tax increase to take account of the shortfall that Toronto is experiencing, just to name one city, the one that I'm responsible for, is not on in terms of people struggling right now to make do with what they have to pay. The notion of dramatic cuts to services, the kinds of services that are keeping people in their lives and living their lives within the City of Toronto, whether it be childcare, student nutrition, transit, parks, not on. And so I don't think there is any option but for these other governments to step forward. They have sources of revenue. They have the ability to borrow and run deficits, which we do not. They have sources of revenue which we don't have, and they will be the beneficiaries of a strong recovery that will be driven by cities because they will get the income tax, corporate tax, and the sales tax revenues that come from a revived economy. And so I'm just going to continue to press that case, and I believe in the end it should be led by the province because we're frustratingly reminded frequently about the fact that we are creatures of the province, like some sort of pet, but in fact what we are is the economic engine of this province and of this country, and I think that we have to have the attention of these governments to look after what are very dire circumstances that are facing all the cities in Canada, including Toronto.
And we've heard some anxieties from people as we talk more and more about more businesses reopening, people who will be in a position to go back to work but don't love the idea of having to ride public transit for fear of exposing themselves to COVID-19. But they worry about the expense of, say, having to drive and park. Is there any role for the city to play in maybe giving people like a break on city-owned lots for parking so that they can safely get to their workplace and get the economy going again?
Well, I've been very careful in not taking anything off the table, but having just finished talking about the financial problems of the city and the dire straits that we're in, obviously we have to rank the different kinds of things we can do, and it has to start with our caring for the most vulnerable people, because that will be a continuing challenge in front of us as this pandemic hopefully winds its way down. And so we won't rule anything out. We're going to try and make plans for the transit system to make sure it is safe for people to ride. We're going to make additional active TO arrangements so that people can ride on bicycles and go on foot in places where they may choose not to use public transit for the time being. I certainly hope most of them will not drive cars, because that is not in the interest of a sound environment. It is expensive. So we're going to try to do everything else we can to support people in making choices other than to drive their cars. And that will start with making sure that we try to make adequate arrangements for a safe transit system.
Okay, thank you. Excuse me, we'll go to Michelle McQuigg now from the Canadian Press. Hi, Michelle.
Hello, Mayor Tory. Thank you for taking my question. You alluded just now to plans to revisit transit services in light of the fact that people are now heading back to work today in greater numbers, and that is likely to continue. Are you able to shed a bit more light on how you plan to approach transit? Are you trying to maintain the current service levels, or do you anticipate changes?
Well, the service levels have been adjusted to take account of the fact we have dramatically low ridership. It's running, at sort of, I think, an 80% reduction over normal times. And so obviously there are plans in place, some of which will be discussed at the Commission when it has its meeting this week, to take account of increasing traffic, which likely, given the nature in which the economy is being reopened, will not happen all at once. You will get a gradual uptick in transit ridership. We hope that is the case, because we want people, as they return to work on a gradual basis, consistent with improved public health numbers and not before, to use public transit wherever possible, and certainly all the ones that did before. And so they're doing service planning on that basis. And then, of course, we have to add on top of that the public health considerations that are now in play. And so that makes it a complicated matter, but it's one that people are busily engaged in at the Transit Commission and in the Recovery Task Force, and for that matter in our discussions with the business community about how we can safely and in a healthy manner and effectively reopen the economy.
Thank you. And speaking of discussions, I have a question with regard to baseball in the city. You've probably seen reports that Major League Baseball is considering a relaunch in early July, but that the Blue Jays might have to continue playing home games in Florida because of the quarantine restrictions on international travel. Is this something you've been in discussion with the league or the team about in any way? And can you shed any light on whether or not we might see them in the city at some point this summer?
Mr. Shapiro called me, and I indicated this to the media a while ago. Mr. Shapiro called me only to tell me they were in the very early stages of some discussions that could see teams play baseball somewhere. He did say at that time that the likely contemplation was that if the team was to resume training, that would happen at their training facility in Dunedin. We briefly discussed the fact that that was at a very early stage, and we discussed the complication that exists for all of our sports teams of the border and the quarantine requirements that are presently in place. And beyond that, it was a very top-level discussion, and you'd have to ask the Blue Jays and Major League Baseball for anything that's transpired since then, which was a couple of weeks ago now.
Okay, thank you. We'll go to Richard Warnica now from the National Post. Richard?
Hi, Dr. Davila. One of the concerns I've heard from doctors and epidemiologists and public health experts who aren't in the actual public health system is that as restrictions ease, they're concerned about the capacity to quickly locate new cases, locate new outbreaks, test them, track them, and quash an outbreak before it gets out of control again. How are you feeling about the city's capacity to stay on top of this as restrictions ease and as the potential for community spread increases?
So that's an excellent question, and it's certainly one that figures prominently, I think, for us at Toronto Public Health, but I would say as well for our provincial counterparts. And the reason why I say that is that, as you know, you alluded to the many steps that are required in order to identify new cases and all their contacts. Everything from testing to the laboratory to then transferring those results to local public health, and then the follow-up has to ensue. And so, as you can well imagine, that involves the partnership of many different parts of the health system. So people actually get tested at assessment centers or, through the healthcare system, which is separate from public health. Those results then go to a provincial laboratory or to a private laboratory that's being operated under the auspices of the province. Then once that information, once you actually have a diagnosis premised on that test, it then goes to local public health units throughout the province for their follow-up. So you can see that there is quite the process that has to be maintained, and different parts of the system that have to work well with each other. So with that in mind, we are certainly looking at our elements in the process, those parts that are within our control at Toronto Public Health. We have a number of projects and initiatives happening in concert with assessment centers, to name one example, to try to make sure that we are taking every opportunity to reduce any time lags and to heighten effectively the efficiency of the entire system. It's complex, but it's important work, and we completely recognize that successfully reopening this city and all the other jurisdictions around the province will rest on our success in that work.
You mentioned all the different players in this process and how complex it is. Is that a factor in why it seems to be so difficult to get an overall answer as to how prepared we are in Toronto, in the province, on all these different levels to reopen?
I think that's part of it. I think as well, what's interesting in the system is that even the notion of getting in contact with people, cases, but contacts, I would say more prominently. There are often attempts made, and I don't have a specific number yet, but I was just talking to staff in the office earlier this afternoon, in fact, on this very issue. And one of the challenges that we're finding in terms of doing that contact tracing is actually making connections. So even when we have appropriate numbers, and there are moments, I will be very upfront, there are times where we don't actually necessarily get all the information we need up front. Particularly when it comes to cases. But even when we do have appropriate contact information, we don't always manage to make connections with clients. They don't always answer their phones. So there are a series of little delays that may happen in the system, to say nothing of the handovers that I spoke of earlier in my earlier answer. It is a complex system. There are, I think, opportunities for improvement, and I think what's really heartening here is that we're seeing real interest on the part of our partners. Assessment centers was one example I provided to you. Healthcare partners, they're really interested in working with us to figure out how do we do this better, how do we do it faster, so that we can actually open up our city with success, knowing that we have the capacity we need to do that case and contact tracing.
Okay, thank you. We'll go to Christina Tenaglia now from CP24. Go ahead, Christina.
Hi there, thank you so much. Dr. Davila, in Newfoundland and New Brunswick, they are now practicing what are these double bubble ideas where, here in Ontario, families can only gather in their immediate household if they all live there together. In New Brunswick and Newfoundland, the double bubble idea is that you can congregate with another household, but you both have to agree it's just, your household and this other household, but it allows people to congregate a bit more. How close do you think we are to that in the city, but obviously here in this province? Just your opinion.
So, I think we're monitoring our data very carefully to, start to move towards easing up on public health measures. And certainly we've heard of the double bubble approach that's being taken on the East Coast. So absolutely watching that. I think we are still monitoring very carefully for now. We're still with the single household perspective. And of course, I have to look to my provincial colleagues as they also have, there's an existing order that is still in place in respect of gatherings of more than 5, which are not currently allowed. And I would imagine for a number of households that would readily exceed that provision. So continuing to monitor data. We certainly have activity happening, as I indicated in my remarks, but we are very hopeful as we continue to press on physical distancing and all the other good hygiene measures that help to reduce the spread of COVID-19, that we will get to the point where we can continue to further ease up on some of our existing public health measures.
You or Chief Pegg can comment on this. Gatherings in the province, of course, as for the provincial order, are limited to no more than 5 people, and they're restricted to members of a single household. Obviously, everyone can empathize with missing family and wanting to see them. Wondering for your reaction on the Premier saying that he, met with his family over the weekend. He has 4 daughters. 2 of them don't live in his household. That would be 6 people, including 2 not from the immediate household. Is he in violation of the rules in this province?
Who is that question asked
Yes.
of? Chief?
I'll send it to Chief Pegg if the Chief doesn't mind, unless Dr. Davila wishes to comment.
Well, I'll start, Christina. To be candid, far be it for me to make comment or to attempt to understand what happened in anyone else's household over the course of the weekend. I can certainly tell you that in my case, my net sum exposure over the course of the long weekend of Mother's Day was a total of 2, and done with intent. And I can also tell you very candidly that these are conversations that the people sitting at this table and that our team has very, very candid and very regular conversations about, complying with not only the rules per se, but complying with the best public health advice that Dr. Davila has given to us is something that is critically important to all of us. And I can tell you that I have, and I have every confidence that my colleagues at the table have as well. So Dr. Davila may want to add to that.
Yeah, I think that what you're seeing is, in fact, evidence of a very human desire to connect in person. It's hard to argue against that. My advice to the public is to continue to maintain your household bubble for now, because we are still in the midst of trying to control the spread of COVID-19 in our community. And the best thing that we can do for now is to continue to maintain that physical distancing and to continue to maintain restrictions around staying in one household rather than mixing several households at once. But I completely appreciate that very human desire to connect in person, and we are doing everything we can to help get us to those circumstances where we can allow for easing of public health measures so that we can get back to enjoying our city and, frankly, get back to enjoying better time, in-person time with our loved ones.
Okay, thank you. We go to Matt Bingley now from Global News. Matt?
Hi, good afternoon. Mr. Mayor, Premier Ford was asked about requests such as yours for funding for municipalities and said that he's waiting on the federal government to come out with one before really sort of going shoulder to shoulder with them on that. How patient are you when it comes to waiting for an actual announcement for something like this?
Well, it's not a matter of my patience. I'm a very patient man, and I go about these things in a very collegial manner. But I've also been reminded many, many times, even in the short time that I've been mayor, and I guess I also learned it in law school, that municipalities are the exclusive purview, the exclusive responsibility of provincial governments. And as a result, I'm very confident that we can bring the federal government to the table to be a partner, as has been done in a number of instances so far during this pandemic. But I think first move probably rests with the provinces because, as we're reminded from time to time, we are creatures of the province. I said earlier on, sometimes you think of that as a pet. Well, we're no pet. We are a big, sophisticated series of governments, whether it's Toronto or Mississauga or London or Sudbury or Ottawa, that are delivering vital services to people that are bigger than many provinces in the country. No offense to Prince Edward Island. I love the place. I've been there many times, and I respect its role in Confederation. But they have a population there that is 5% of the population of the City of Toronto, and yet we're expected to deliver all kinds of services and don't have the kinds of tax revenue powers and the kinds of latitude they have to do things. And so I think that it is a reasonable expectation that the province will step forward and say, we take this responsibility as being one that we have under the Constitution and we're going to take it up. We would like the federal government to be alongside us, and I assure you, if that is done, I will be there, as I am now, helping to bring that relationship together so that they can help the cities across the country, which is really the most important thing if we're going to have a robust and complete recovery. Cities need to be part of that. Cities need to be healthy and financially stable, and I'm determined to, on my own behalf as Mayor of Toronto, but also on behalf of my colleagues across the country, to fight hard to make sure that happens.
Thank you. And my second question is for either Dr. Davila or for Marianne Bedard. I'm just wondering if you could tell me how many other individuals experiencing homelessness are currently in the ICU?
So I don't have that information directly. I don't know whether Marianne has that on, at her fingertips.
Marianne, were you able to answer that?
Brad, no, unfortunately I don't. I believe there are 9 people in hospital, but I don't know whether or not, their status in hospital.
Okay, we'll get that answer for you, Matt, and get back to you. Thank you. Okay, final question now to Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi. I have a question for Mayor Tory and a question for Chief Pegg. Mayor Tory, is the Digital Main Street a new program? And when you say that you tripled the budget early on, do you mean early on in the pandemic, or does it predate the pandemic?
No, we tripled the budget for Digital Main Street, which has been a program around for a number of years and hugely successful. I think thousands of companies have established through Digital Main Street an online presence for the first time. So we tripled the budget of Digital Main Street during the pandemic as a means of trying to help those businesses to get online. And this is now another initiative which will help another 3,000 businesses to get online with the cooperation of all the corporate partners and the Schulich School of Business and the BIAs. And so it's a further initiative to help people get online and thus develop new ways to sell to their customers and to new customers.
Thank you. And for Chief Pegg, were there any problems flagged today with retailers opening curbside?
Thanks. Excuse me. Thanks, Francine. Not anything that's come to my attention. Of course, still very early, and we'll monitor that. And I would expect, as I always do, we'll get an update early tomorrow. But I can tell you that the work that the team put into developing the guidance documentation that I referenced in my remarks that's on the toronto.ca/COVID-19 website, the feedback I am hearing is that it has been significantly helpful for businesses and business owners. And like we talked about, it really goes through 3 areas that are of primary importance, or 3, I would say, overarching themes. The first is education. So there's a number of educational aspects to that, providing some advice and guidance to business and business owners on how they can behave and steps they can take to ensure that they remain in compliance. The second is engineering solutions. So like we talked about late last week, things like the Curb TO program with some changes to curb lanes and different engineering solutions. And then the third is enforcement. And I should say, just for clarity purposes, the first 2, the education and engineering aspects of all of our plans, those are robustly reviewed and debated, if you will, at our strategic command team table. The enforcement piece, I think, as we can all appreciate, is not. Enforcement is the final part, but enforcement happens under independent authority. And we would never, of course, and we don't, dwell or move into the point where there is any attempt to direct any type of enforcement. That happens under the independent authority of the enforcement officers. There is simply a coordination that happens around the city agencies. So education, engineering, enforcement, all online, hearing nothing but good, and we'll, I would say we'll get some updates over the next couple of days with respect to how that seems to be going.
Okay, thank you very much, everybody, and we will talk to you again tomorrow at 3:45.